The Choose Form and Report tab allows you to submit clinical information for your patient and manage their participation in the screening programs. Submitting medical information for your patients is crucial. Accurate and timely submission helps ensure your patients are assigned to the correct screening pathways and receive the appropriate reminders and follow-up from the program. Without this information, there may be delays in care, and the follow-up team may need to contact you if your patient has a positive result. You can select to view forms and reports for either program. If they are only participating in the Bowel program, only those forms and reports will display. The following forms and reports are available for the National Bowel Cancer Screening Program. Please note that some forms may not display depending on the patient's screening pathway. This list represents all available forms, not necessarily those for the test patient in this demonstration. GP Assessment Report. For doctors to provide information about a consultation with a patient who has received a positive FOBT result. Colonoscopy Report. For colonoscopists and GPs to report the results of the colonoscopy procedure for a patient with a positive FOBT result. Adverse Events Report. For GPs and colonoscopists to report on an adverse outcome for a procedure relating to your patient. Histopathology Report. To report the results of tested specimens collected during the colonoscopy procedure for a patient with a positive FOBT result. Healthcare providers play an important role in having proactive discussions with patients about bowel cancer screening and the importance of completing FOBT or bowel screening test kits. You can request an FOBT kit be mailed to your patient if they have lost, misplaced, or damaged their kit, or it has expired, or they are aged 45 to 49 and want to receive their first kit and join the bowel screening program. Once they've completed the kit and their samples are processed, they'll automatically receive the kit in the mail every 2 years. Through the Alternative Access to Kits model, you can bulk order bowel screening kits for your practice via the NCSR Healthcare Provider Portal and use the NCSR Hub MedicalDirector to record when a kit is issued during a consult and provide a replacement participant details form to the patient. This process is detailed in our other video guides, bulk order bowel screening test kits, and issuing a bowel screening test kit to a patient. You can also submit the following forms to manage your patient's participation in the bowel program. Defer bowel program. To change the date of your patient's next screening, perhaps because of travel or other reasons. Opt-out bowel program. Your patient can resume participation at any time via the participant portal or calling the NCSR. The replacement participant details form request generates a new form to be delivered to your patient's address if they have misplaced the one provided to them with their kit. To find out more about the National Bowel Cancer Screening Program, visit Health.gov.au/NBCSP.